total estimated cost of diagnosed diabetes in the U.S. in 2012 was $245 billion. Medical expenditures for people with diabetes are about 2.3 times higher than for people who don't have the disease, due largely to the complications of the disease, whereby a decrease in the immune system's ability to fight off infections leads to its complications. Periodontal disease is one of those infections which can adversely affect the diabetic patient.
Inflammation sets up a reaction that causes things in our body that makes us less responsive to insulin, which is how we develop type 2 diabetes. So whether it is inflammation from just a fat belly, or whether it's inflammation from gum disease, or whether it's inflammation because you've got a chronic abscess someplace, it causes the same process of a resistance to insulin, which leads to type 2 diabetes, or is the hallmark of type 2 diabetes.
Your blood sugar will not go down if you have an active periodontal infection, because when you have an infection of any kind in your body, it stimulates your liver to release sugar because your body wants to fight off that infection, and it needs that sugar to go into the cells of your body to give your cells the energy that it needs to fight off that infection. The problem is that when you get that blood sugar released into your bloodstream, it can't get to where it needs to go. We don't have the transport mechanism, the insulin, to bring it into the cells. And so the problem never goes away, okay? It can't fight off the infection. So diabetic patients understand that they'll say to me, I can't fight off infection very well. And they're exactly right. Their bodies do not fight off infection. That's why they have wounds, and that's why they have a lot of chronic conditions. The other thing is that sugar is just what bacteria feeds off of. Okay, so if you have an infection in your mouth and you have high blood sugar in your system, you're giving that infection exactly what it needs to grow. So it's a catch-22, and it's not going to go away.
We carried out a study where we asked the question, which comes first, diabetes or periodontal disease? So we took a group of individuals who did not have either disease, periodontal disease or diabetes, and we followed them for years. And this is one such case. This is a 35-year-old female with neither periodontal disease or diabetes. She was a happy young woman, and everything was just fine in her life. And then about 3.5 years later, she developed very severe periodontal disease. And you can see the loss of bone in this area and upper teeth. So much bone is lost that the teeth have actually migrated. Some of the back teeth have so much bone loss that they're about ready to fall out. And this is what she looked like clinically at the time of the second visit. You can see the teeth have spaced. There's actually, there are abscesses, which are gum boils, which hurt. What we found is that in the time between the two visits, she also developed diabetes. And periodontal disease will actually lead to, be one of the factors in the initiation of diabetes. Now, there is another facet of the relationship between periodontal disease and diabetes, and that is if a patient has diabetes and also has periodontal disease, the periodontal disease makes diabetes worse. So it's a wonderful example of the interaction between the mouth and the body in both directions.